You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. And I have Dr. James Babiak, and he's the Wisdom Tooth Doc. He's created a process for wisdom tooth extraction that gives the patient a better experience than what they currently need now, and it actually avoids the need for addictive opioid medications, oxycodone, OxyContin, et cetera, which, my family's had some personal experience with, as I'm sure to a lot of listeners, and they're terrible. They're like deals with the devil taking those things. So if anyone can create a process to take out wisdom teeth without them, that's a great thing. So that's why I'm talking to him. So James, thanks for coming. How you doing today?
I'm doing well. Thank you for having me. Good to talk to you.
Yeah. So tell me about this process. How did you figure it out in your work?
So I am practicing oral surgeon in Chicago suburbs. I've been doing this for about 25 years now. And what I've noticed over time is that you see cycles of what people are doing in practice and what's going on in the world. And the thing that really has stood out to me over the last few years is the number of people that I would see where they're taking narcotic medications, some pretty heavy duty addictive drugs, and then you talk to them and you're in the process of determining what's going on, what you need to do, and people will tell stories of how they started with back pain or they started with shoulder pain and their doc started them on these drugs and it's been 10 years and they take 4 a day and 6 a day. And just over time, it really started to see just a higher and higher number of my patients who are taking them, even people in their 20s, just long-term high-dose medications. And that got me thinking with the type of stuff that I do as an oral surgeon. Removal of wisdom teeth is a pretty big part of our practice. And we're dealing with the average wisdom tooth patient as a kid, high school age, 14, 16, 18, in that range. Very many of them have never received any strong pain medicines for anything because they're young and they haven't had anything happen to them yet. And then just reading news stories from a local paper, and you just keep reading about kids overdosing and dying, and the local government, the county government, issued a press release a few months ago about how proud they were that they only had 183 overdose deaths up to that point in that year, which really got me thinking that's insane that there's that many kids dying and they're proud that it's only that many kids.
Yeah, definitely.
I'm a parent. I've got a high school age kid and a kid in college, and really got me thinking, probably not a good thing for me to be prescribing these drugs. And then doing some research, found actually that the research is that for very many, if not most people, their actual first exposure to narcotic medications is when they get the wisdom teeth removed. So then that really got me thinking that on a whole, my specialty, people who do what I do, really should be looking in a different direction, which then got, of course, me looking in a different direction. So then I developed my system to get these kids taken care of, but in a way where they're not taking the strong pain medicines that have kind of become, I'll call it, the industry standard. That's just what everybody does is they see the kid, they do the surgery, and then they prescribe these things. So I kind of grabbed the bull by the horns and took it upon myself to get something changed.
Yeah, I'll tell you, an experience I've had. Well, my wife had. She was in the hospital, and when she got out, they gave her a prescription for like OxyContin, and they gave her all kinds of stuff in the hospital, and they didn't tell her anything.
Yeah.
They didn't tell her it was addictive. They just say, "Here you go, have a nice day, bye." And
it's just,
I started reading about it like crazy, and I saw all these stories of people that couldn't get off it, and I felt sick. I was like, man, this is a deal with the devil. What am I going to do? And I talked to my wife about it right away, and she was like on board with it, and she slowly got off the meds. She deliberately, like every 3 or 4 days, cut the dose down, slowly, but it was a horrible thing, and she tried real hard and did it, but it still took like a month, and that's with active trying. I can't imagine that, a 15, 16-year-old kid takes it and thinks they're indestructible, and they're like, oh, wow, this feels good, and they just keep taking it, and before long they're hooked.
Some of them do. Some of them actually will look at it as a money-making enterprise because realistically, if somebody has leftover narcotics, they can sell that pill on the street for $20.
Yeah.
So some people will just go to the street corner and sell their prescriptions just because it's an easy way to make money, and it didn't cost them anything. Their health insurance paid for the prescription, so it's all profit. So that's the second deal with the devil that is part of the whole problem, and it's a nationwide problem. It doesn't matter what part of the country you go to, you see similar things.
Yeah, the medical world has made it really difficult to get it, but they've totally dropped the ball in terms of education on how to handle it when you're on it and what to do and all that. And it's like, it's not like being a diabetic, but in a way it is. Like you're taking these pills, you have to have an outpatient consultation is what they should do, and tell you all the dangers and what to do and how to respond and how to cycle off of it and all that. And they don't do any of that stuff. It's terrible.
Some of the chronic pain doctors will do stuff like that, but the majority of people writing prescriptions they'll write the prescription and send you on your way. Now, it's not because they're bad people. It's because there really is no avenue for them to actually be educated in how they should be modifying things and doing things differently. The medical and dental schools don't cover that. None of the associations really cover that well. Some of them will have narcotic education for providers, but they'll send you an email, and as with many emails, the docs don't click on it, or they click on it but they don't actually read it. So there really is it's just such a multifaceted problem, and I'm doing my thing to try to change things in my corner of that world.
That's great. So, all right, so let's get into the method. What did you discover, and then what have you, along the way, and what have you figured out now?
Well, I looked at first the actual procedure. When we see a kid for wisdom tooth extraction, it's a procedure that is done under sedation, and in the standard sedation protocol, that's one thing that people don't realize, that intravenous narcotic medications are part of the standard protocol. So it took some time, and I modified what I was doing, because you can't just eliminate one medication and do everything else the same and expect the same result. So a little bit of trial and error, a little change here, a little change there, and have developed it to a predictable system with the same anesthetic result, the same experience for the patient without using that intravenous narcotic. The one that's typically used is something called fentanyl, which is one of the most addictive substances that's available. So I modified the anesthetic technique so people don't get exposed to that medication. And then you have to take it to another step, because that medication provides postoperative pain relief. So you have to then alter the technique again in order to make sure that they have the same post-op pain relief and they don't wake up having discomfort. So there was some modification there. Then we added some pre-op tissue conditioning things that we do, that there's a gel, there's a rinse. It's things that are designed to increase the healing capacity of the tissue. So you're hitting it before you do anything surgically in the area, to allow the tissue to heal quicker with less inflammation, and with less inflammation they have less pain. Then I modified my surgical technique.
Quick question: if I ask you anything that's proprietary, just let me know. Don't worry about it. But the more detail you can give, the better. Just so you know.
Yeah, that's the way I'm talking is a way to not give the proprietary stuff at the same time. So yeah, I thought about that.
Okay, go ahead.
So the surgical technique is also something that can lead to post-op issues. So little tweak here, tweak there, and the way that I'm doing things is designed to reduce inflammation. And then there's some post-op therapy, and the end result is that they go home with prescription strength anti-inflammatories. We don't prescribe any narcotics, but they don't need the narcotics. Now, there is always that chance that because everybody heals differently, everybody responds differently. So there's no way I could sit here and say that I am absolutely zero narcotic. There is no situation where I would not prescribe something, because that's just if someone truly needs something, then they need something, and then the goal is to limit what they get, so they get the absolute bare minimum, so they're comfortable and able to get through their recovery comfortably. And the way we do that is that they leave after their procedure. They don't have the prescription for narcotics, but they know that if they're that one kid where they need something in addition to everything that we do, then if it's 3:00 in the morning, we will meet them at the office and make sure that they get taken care of. The net result so far is that we've never actually had to meet anybody at the office and get them a prescription for something to take care of things beyond the protocol, that the wisdom tooth doc protocol that we follow.
So what are some of the benefits that patients have told you and that you've observed clinically?
I can actually give better than clinical observation. I can give personal observation. My 14-year-old, my youngest daughter, had got to the point where it was her turn. She was ready for her wisdom teeth to be extracted. So obviously I've developed the wisdom tooth doc protocol. I believe in it, and I'm going to make sure that my kid is treated the same way that I feel my patients should be treated. So we did everything for her exactly the same as we do any other kid. She had her wisdom teeth removed on a Friday. She had minimal swelling. She had no discomfort. She never needed anything beyond the anti-inflammatory that she was taking. Even taking that, she said she didn't feel it. She didn't have any discomfort. She was just taking it for the anti-inflammatory effect. No swelling, no bruising. She went back to school on Monday, and her friends would not believe her that she had her wisdom teeth out on Friday. At a week, which is what I see with the overwhelming majority of my patients, when you see them at a week for their follow-up, you look in their mouth and it doesn't look like anything was done. The way that we kickstart healing has just such a profound effect that really makes me wish that when I had mine done, I was a little bit older. I was 21 when my wisdom teeth were removed, but it really makes me wish that I had developed that before, and the doc who took out mine followed this protocol, because Miranda's experience was nowhere near the same as my experience.
Yeah, I guess I'm weird in the wisdom tooth world. I didn't get any wisdom teeth until I was like 30, and I've had one that's slowly growing in for like the past 13 years. And but otherwise, I'm lucky I've escaped any wisdom tooth trauma. But
my
my
oldest daughter has none, so it's a wide range.
Yeah. So what's your goal here? Are you gonna? I mean, you're using it in your practice, but do you want to license this out to other, well, not dentists, but oral surgeons?
My goal is to grow the wisdom tooth doc into a larger and larger entity, and provide this service to as many teenage kids as we can, and just improve the experience. It's anybody you talk to that has kids in high school that have had wisdom teeth, they all talk about the kid with the pumpkin face, and they're miserable for a week. And I'm trying to change that, and I'm trying to just broaden the scope and number of kids that we can serve.
Well, I mean, you can only serve so many. So at some point, I don't know if it's a patentable method or anything, but at some point, you'd want to disseminate it to dozens and hundreds of other practitioners. So, tens of thousands of people can be helped.
Yeah, that's as we grow, then we look at the options of adding offices versus licensing versus franchising. This is something that should be a national practice, a way to improve the care that everybody's getting.
What about for other surgeries? I mean, there's many surgeries out there, and there's many recoveries, long and short and difficult. And, what about licensing this for other areas?
It definitely is possible. Yes. There are some of the things that are tailored for the way the inflammatory process in the jaw works, which is different than the inflammatory process in the belly. But just like I had to tweak to get to this point, it can be tweaked to get to the point to help others with other types of surgeries. There are some types of surgeries where stuff like that really is unavoidable. Spine surgery, stuff like that. The level of discomfort, there is no option available at this point. But I think if we get the ball rolling and get the process started where people are looking at if we can show the success to enough people, and they look at, well, how are we doing it? How are we avoiding the narcotics? How can I change what I'm doing? And then, there definitely is a possibility of broadening this to all specialties and all types of procedures. And the drug companies might not like it, but interesting thing, just this week, the company that makes OxyContin is looking at filing for bankruptcy because they've had so many lawsuits, they can't afford to pay them.
So I guess last question or two, any big surprises you had along the way in developing this method, or any hurdles that really seemed like insurmountable and, without revealing too much, I mean, what can you say about what you learned?
Well, I've learned a couple things that in a way surprised me, but then when I look at it, I probably shouldn't have been surprised. As I develop the technique, I'm looking at, well, we have to do this, we have to do that. So obviously the costs increase because of the different way you're doing it. The cost to me of doing things has increased. So I was hesitant at first to roll things out because I was thinking that people wouldn't be prepared to cover the additional expense. In the back of my head, I'm thinking, well, people want to minimize their out-of-pocket, let their insurance cover as much as it can. So I was kind of surprised, but again, shouldn't have been, that that there really is a groundswell of parental support for avoiding these things, and my patients' families look at what the standard technique involving using addictive drugs costs. This is what it costs to go down a better path, and they're okay with that. They're willing to go down the better path, which is really kind of heartening. We're living in a very pessimistic age, and so it's good to actually get some reassurance that people still care and people still want the best for their kids, and so that's a good thing. Other thing that definitely has surprised me, which is a little bit of a hurdle, is in talking to people that I know, other oral surgeons in other parts of the country, talking a little bit about what I'm doing and how I'm doing things, and seeing resistance on their part. Well, it's this is how I've always done it, so this is how I'm going to continue to do it. So it actually surprised me on that end that a lot of guys who do what I do and who write prescriptions for narcotics all day, every day, are just planning on continuing that, which really opens up a pathway for the growth of the wisdom tooth doc practice.
Yeah. Well, very good. So what's the best way for people to get in touch, with questions? Maybe they want to find out right away and try to license it from you. I don't know if you're ready, but how can find out more?
The best way is to send an email to my manager, and the best email would be info@wisdomteethjoliet.com.
Okay.
Practice phone number is 815-254-1560. We are always available and always willing to talk to anybody.
Yeah, for people listening in that area that have wisdom teeth issues or family members do, they can definitely contact you. And then for people outside, they can email.
And website is wisdomteethjoliet.com.
Okay, very good. Well, James, thanks for coming on the call. I really appreciate it.
Thanks for having me.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.